If you were told that a silent guest lives on your skin and in your nose every single day, you might feel uneasy. The truth is, Staphylococcus, a group of bacteria, has always been part of our world. For most of us, it sits quietly, causing no harm. But sometimes, under the right conditions, this tiny organism can turn into a dangerous invader capable of making us very sick. Staphylococcus bacteria are round in shape and love to cluster together, much like grapes on a vine. They are hardy, able to survive both with and without oxygen, and are perfectly at home on human skin and mucous membranes. Among the many species, 3 stand out when it comes to human health: Staphylococcus aureus, Staphylococcus epidermidis, and Staphylococcus saprophyticus. Of these, Staphylococcus aureus is the real troublemaker. This species is equipped with weapons, enzymes, and toxins that allow it to invade tissues, destroy cells, and sometimes overwhelm the body's defenses. While Staphylococcus epidermidis is usually a harmless resident, it can sneak into the bloodstream through catheters or implants. Staphylococcus saprophyticus, on the other hand, is notorious for causing urinary tract infections, especially in young women. When the quiet guest turns dangerous. Imagine starting your day with a small cut on your finger. Normally, it would heal quickly, but if Staphylococcus aureus finds its way in, it can cause a boil, painful, red, and filled with pus. Left unchecked, the infection may spread deeper, causing cellulitis or abscesses. Other times, Staphylococcus does not even need a wound. If contaminated food is eaten, its toxins can act quickly, leaving you with nausea, vomiting, stomach cramps, and diarrhea just hours later. It is one of the fastest food poisonings known to man. In hospitals, the story becomes even more alarming. Patients recovering from surgery, people on ventilators, or those with weakened immune systems can fall victim to bloodstream infections, pneumonia, or even infections of the heart valves. At its worst, Staphylococcus aureus can trigger toxic shock syndrome, a sudden, life-threatening reaction marked by fever, rash, confusion, and dangerously low blood pressure. Why Staphylococcus spreads easily. The tricky part about Staphylococcus is how easily it moves from one person to another. A handshake, a shared towel at the gym, or even improperly handled food can pass it along. Hospitals, where many people are vulnerable, can sometimes become breeding grounds for resistant strains that no longer respond to common antibiotics. Recognizing the symptoms. The signs of a staphylococcal infection depend on where it strikes. On the skin, it may appear as red boils, blisters, or swollen patches. In the stomach, it brings sudden vomiting and diarrhea. In the lungs, it causes coughing, fever, and chest pain. In the bloodstream, it leads to high fever, chills, and weakness. In severe cases, toxins can trigger body-wide reactions that threaten life itself. How to stay free from Staphylococcus infections. The good news is that while Staphylococcus is common, protecting yourself is possible. It starts with something as simple as washing your hands. Good hygiene, cleaning wounds properly, covering cuts, and avoiding the sharing of personal items like razors or towels goes a long way. In the kitchen, food safety is crucial. Washing hands before cooking, refrigerating leftovers quickly, and cooking meat thoroughly help prevent staphylococcal food poisoning. In hospitals, strict sterilization practices, careful handling of catheters and surgical instruments, and constant monitoring are vital in reducing infections. For individuals, maintaining a strong immune system through a balanced diet, regular exercise, and adequate rest also lowers the risk. Finally, Antibiotics should be used wisely. Overuse and misuse are what give rise to resistant strains. Always follow medical advice and never stop a prescribed course halfway. Herbal remedies and natural recipes against Staphylococcus. For centuries, traditional medicine has relied on herbs and natural preparations to fight infections. While medical treatment is essential in serious cases, these herbal remedies may support the body in preventing and fighting mild staphylococcal infections. 1. Garlic drink. Crush 3 to 4 fresh garlic cloves and steep them in a cup of warm water for 10 minutes. Drink once daily. Garlic contains allicin, a powerful natural antibacterial compound. 2. Turmeric and honey paste. Mix 1 teaspoon of turmeric powder with raw honey to form a thick paste. Consume 1 teaspoon daily or apply the paste gently on small skin boils to reduce inflammation and fight bacteria. 3. Neem leaf wash. Boil a handful of neem leaves in water for 10 to 15 minutes. Use the cooled water to wash infected skin areas. Neem has strong antimicrobial properties. 4. Aloe vera gel. Apply fresh aloe vera gel directly on minor skin infections. Its cooling, antibacterial, and healing properties soothe irritation and aid recovery. 5. Ginger tea. Slice fresh ginger and boil in water for 10 minutes. Drink warm. Ginger enhances immunity and reduces bacterial growth. 6. Oregano oil dilution. Add a few drops of oregano oil to a tablespoon of coconut oil and apply lightly on affected skin. Oregano oil contains carvacrol, known for its antibacterial action. Final thoughts. Staphylococcus is a part of our everyday lives, a quiet passenger on our skin, waiting for the right opportunity. Most of the time, it coexists with us peacefully, but when conditions allow, it can transform into a dangerous adversary. Recognizing its symptoms early, practicing good hygiene, and taking preventive steps are our strongest shields against it. Alongside these practices, simple herbal remedies like garlic, turmeric, neem, and ginger can strengthen the body and help reduce the risk of infection. In combining the wisdom of nature with the precision of modern medicine, we give ourselves the best chance to stay free from the hidden enemy on our skin. And don't forget to like, share, and subscribe to this channel. Thanks for watching.